Hello people, welcome to my channel Physio Guide by Divya. Today I am going to teach an interesting topic about stroke. Main headings I am going to highlight. So this is a vast topic. So in short I am going to explain this stroke. So let's start our video. First of all, what is stroke? Stroke, or we can call it as a brain attack. Brain attack. Okay? It is a sudden loss of the neurological function. Why there is sudden loss? Because there may be any interruption of the blood flow. See, blood is flowing and there is an interruption, break, so that there is no blood flow here. As a result, there is interruption of blood flow to the brain. So this is stroke. Now, by WHO, World Health Organization definition is stroke is defined as a rapidly developing clinical signs of focal, means specific region of the one place, specific region of the brain. Global means group, wide range of the brain area. Okay, wide range. Okay, to a specific area, to a wide range, disturbance of the cerebral function with symptoms lasting for 24 hours or longer, or leading to even death also, with no apparent cause other than the vascular origin. This is a definition. I'll give the notes also in the description. Now once see the brief idea of it. Okay, now what is the epidemiology? Means what is the rate of people getting affected by the stroke? Stroke is the third leading cause of the death and the most common cause of disability among adults, and the incidence of stroke is about 1.25 greater in males than females. Okay, it is greater in males. Next, the incidence of stroke increases dramatically with age. So as we grow age, it increases, the risk is more. And the decade after 65 years of age, it is more often. Okay, now etiology means origin of disease, where this disease is most means where this disease starts. Origin, where means atherosclerosis. This is a major contributory factor for causing this stroke. It is characterized of plaque formation, means like dust like formation, plaque formation with accumulation of lipids, fibrin, complex carbohydrates, calcium deposits. So as a result, there will be blockage of the blood flow. Due to block, there will be narrowing of the blood vessels. Now we'll see the pathophysiology step by step how stroke occurs. Means first of all, there is interruption of blood flow. Next, for few minutes there will be interruption of blood flow here. Next, as a result, complete cerebral circulation will get arrest. Next, cellular damage is seen. Next, excess release of neurotransmitters. As a result, there is excess release of neurotransmitters, and disturbance is seen in the energy metabolism, because energy can't produce properly. Next, inability of the brain cells to produce energy as a result. Next, excess influx of, see, there will be obstruction, no? So influx of calcium ions cause pump failure here. This calcium influx stimulate the release of the nitric oxide and cytokines. These both will get stimulated. Now excess calcium reacts with intracellular phospholipids to produce free radicals. These both mechanisms further damage brain cells. Now this ischemic stroke produce cerebral edema. There will be increase in the intracranial pressure. To this increase, there is decreased consciousness, increased heart rate, irregular respiration is seen. Okay, these are the problems are seen by the increase in the intracranial pressure. This is a step-by-step process. Now we'll see the types. What are the types of the stroke? There are two main types of strokes. First one, ischemic stroke. Next, hemorrhagic stroke. This is ischemic stroke is the most common. 80% of the cases are seen in the ischemic stroke. It is due to, see here, obstruction of the one of the major cerebral arteries. If it get obstructed, this ischemic stroke is seen severely. Ischemic stroke are the results of why this occurs as a result of there is any thrombosis, embolism, like any clot gets stuck in that area, or any condition that produce low systemic perfusion pressure. or any condition that produce low systemic perfusion pressure. Due to this lack of the blood flow, there is no oxygen, glucose to the brain. Disrupt cellular mechanism is seen, and as a result there will be injury or death to the tissues here what are the present, there will be injury or death also is seen. Next we'll see the hemorrhagic stroke. This is usually due to any abnormal bleeding, like that blood goes outside. It will not get accumulated, it goes outside, bleeding in the extravascular area of the brain, which is usually due to rupture of this vessel, cerebral vessel, or due to any accidents, trauma. Okay. Now hemorrhagic stroke, and due to this hemorrhagic stroke there will be increase in the intracranial pressure, and there is injury to the brain tissues and restriction of the blood flow. This hemorrhagic stroke bleeding, it may be divided into intra means inside the cerebral bleeding, or subarachnoid hemorrhage means at the range of subarachnoid space also there will be bleeding is seen. Classification, it is divided into asymptomatic, no symptoms, and symptomatic patients, and this is subdivided into 4 categories. This next, impairment. Brief I am explaining. Impairment means direct or indirect. Directly what are the symptoms are seen means somatosensory defect means sensation is impaired, and defect is reported in 53% of patients with stroke, and patients sometimes complain abnormal sensations such as numbness, dysesthesia, hyperesthesia. Next, pain, they feel severe headache and neck and face pain. Pain indirectly due to muscle pain, muscle imbalance, or impaired movement pattern, due to it also they feel pain. And visual defect also is seen. Homonymous hemianopsia, this is a visual defect involving due to any optic radiation in IC or primary visual cortex. Next one, motor defect is seen. Muscle, first they feel flaccidity of muscle. Next, that is replaced by spasticity, hyperreflexia, mass pattern of movements, and turned into synergies. These are the defects. Speech and language disorders, it is aphasia, means in this they are divided into 2 types, fluent and non-fluent. Fluent, which is Wernicke sign is seen. Non-fluent, Broca's. Next one, dysphagia means may sometimes lead to aspiration also, and bladder and bowel disturbance also are common. Next, seizures occurs in small percent of patient with stroke. Okay. Next, indirectly, these are the symptoms are seen. Venous and thromboembolism, skin breakdown, decreased flexibility, shoulder subluxation and pain is seen. Cardiac deconditioning, reflex sympathetic dystrophy. These are the symptoms, impaired directly and indirectly. Diagnosis, what are the tests need to be done to identify the stroke? Next, first one is a physical examination. We need to do medical examination and neurological examination need to be done. Firstly, we need to check general vitals. Next, GCS, GCS we need to check eye opening, muscle power. Next, verbal. Okay, these are all we need to check. Next, urine analysis. In this, to detect any infection, diabetes, or renal failure if any. Next, blood analysis, we need to check ESR and blood count. Next, blood chemistry profile, we need to check. That include serum electrolytes need to be checked, serum electrolytes level. Next, thyroid test. Atherosclerosis can result from any hypothyroidism. Due to this hypothyroidism, atherosclerosis may result. Next, full cardiac evaluation we need to done. To ECG need to be done to detect any arrhythmias, okay, and the source of embolism. We need to do lumbar puncture, and imaging, CT scan, MRI also need to be done to diagnose the acute stroke. Okay. Next one, PET scan need to be done to detect any ischemia, so that ischemia is detected. Next one, the angiography, cerebral angiography need to be done if any surgery. When surgery is considered, this scan need to be done. Now we'll see medical treatment. In case of there is lack of the oxygen level, we need to apply mask and nasal canal to establish establish oxygen. Next, maintain adequate blood pressure, BP need to be maintained. Hypotension or hypertension need to be done means high or low need to be maintained. And maintain cardiac output, and maintain and restore fluid and electrolyte balance. Maintain blood glucose, controls if any seizures or infection, and control intracranial pressure, maintain bladder function, and maintain integrity of the skin and the joints. Okay, these all need to be maintained. Next, pharmacology. Tablets, what are need to be given means heparin. This is the anticoagulant therapy. Heparin used to remove perfusion and reduce the risk of the clots. Okay, next one, aspirin for antiplatelet therapy. Now we'll see the positioning, how we need to position the patient. First is side lying, supine and the side lying. These are the main positions need to be maintained. Always position the patient towards the affected side, towards the door of the room. Touching on the affected side improves exteroception. And talk to the patient on the affected side so that the patient will attempt to turn to that side. If the patient is having a flexor symmetry pattern in upper limb and lower limb, the patient should be positioned in the anti-synergetic position. Okay, flexor synergy is common in the upper limb, extensor synergy is common in the lower limb.